I'm Ariel Azor, host of Right This Way, and today we're going to talk about the survival rate of COVID-19. So, I don't know, some of you have probably heard what the survival rate of COVID-19 is. Some of you probably already know what it is. Some of you may not have heard or just haven't been paying attention. I haven't been paying too much attention, and I saw what the number actually was a couple days ago, and I was like, what? Because it's just kind of a staggering number. But I think with all of the things that we do to, keep COVID contained and all of these things that we're doing with colleges and just regular schools, like not even being in session in some places, and just doing everything online, having people wear masks basically anywhere they go, and kind of blacklisting people who don't want to wear them. Like airlines are doing this sort of thing now. They're saying that if you're on the plane and you don't wear your mask, they're going to write your name down and put you in the system as someone who doesn't wear a mask, and then you can't get a flight with them anymore. All different kinds of things. We're seeing airlines also, again, are saying that if people don't get the vaccine when it comes out and is made available to everyone, that they're not going to be allowed to fly with them. Certain airlines, I don't even know which one, because I obviously will not be flying with them. But a lot of these things have kind of turned into not having them as a scarlet letter. So I think it'll be pretty concerning if that happens for things other than just airlines. I think it's silly even if it's happening with airlines, but if kids aren't allowed to go to school, just regular school or college without the vaccine, I think that's going to be something that is a possibility, but hopefully not something that we actually have to fight against, because I think that's a terrible thing because I don't think that's a very good thing. When we're looking at a virus that has I promised I'd get to it, 97 to 99.75% survival rate. It depends on where you look. Some websites will give you a 97%, some give you 98%, and then I saw one that was even 99.75%. That's the survival rate. You would think for all of the things we've been doing because of COVID and the things we've been closing down and avoiding, you would think that this is a really scary, very deadly virus that has a really low that has a really, really low survival rate, because there's so much uproar and hype about COVID and, do your part, wear your mask, all these little slogans that we've coined. And I have seen people near where I live that have signs in their yard that say mask up PA and all this stupid stuff that just kind of makes me mad, because I don't know why you need a yard sign to say put some face covering on your face and don't let people see you smile, don't let people actually hear you and do their jobs properly, because they can't see your mouth moving, they can't hear you because your voice is being muffled by a piece of cloth, literally just a piece of cloth. I was at my friend's house and her mom was very conservative. She works at a clothing store and they sell face masks, and her mom was looking at the back of the packaging, and it literally says right on the packaging, not intended for use against viruses or something like that, not intended for use to protect people for medical purposes, something like that, something silly that is it makes very, very clear these don't actually do anything. This is not just the government, some doctors telling us, yeah, these work, even, when Fauci originally said they don't, and now he flip-flopped and said that they do. Several doctors, I think, have done that. But literally, the business you're buying the face mask from, because it's cloth. And we all should know by now that cloth doesn't do a single thing to protect you from a virus. It doesn't protect you. If you wore a cloth face mask to go and, sand something and that dust gets in your lungs and you're like, oh my gosh, I was wearing a mask. Why are you surprised you had a piece of fabric on your face? Why would you even bother wearing a mask when you could pull your shirt up over your nose and it would be equally as effective? Because they don't do anything. And I know doctors have come out and said, yes, the masks they're not 100% effective, but they reduce your chances of being infected or infecting someone else or whatever they're saying now. Again, same thing with that, as they have said so many different things and they keep just changing their minds because they change their minds to say whatever they're told to say. Whatever works, because what Cuomo wants to make the general rules for the general public, he doesn't follow. And Governor Tom Wolf, who's our governor, less well known in the news, I think, much to his chagrin, but honestly almost equally as bad. They have these crazy, crazy rules that they want you to follow. They don't want you to celebrate Thanksgiving. They don't want you to celebrate Christmas now still.
I hope you all are listening as with all the trouble you're going through. You cannot be traveling during these holidays. As much as you want, I have a large family. Barack used to kid me about it. I mean, everything for me is family, beginning, middle, and end. When one comes, everybody comes. You think I'm joking? I'm not. You know, we would have 16 people go away every Thanksgiving. And my deceased son, before he passed away, we'd all go away, and we'd go away on Thanksgiving to be just a nuclear family. Mom, dad, sons, daughters, husbands, wives, grandchildren. And the first time, we had a Thanksgiving with my wife and myself, my daughter in the region, and her husband, who's a doctor in the region. That's it. All my other kids, everybody else in the family, was on Zoom on Thanksgiving, which doesn't. Well, Christmas is going to be a lot harder. And, you know, I don't want to scare anybody here, but understand the facts. We're likely to lose another 250,000 people dead between now and January. You hear me? Because people aren't paying attention.
Nobody wants you to have fun or go live a normal life, and they don't want businesses open. This is one of the things that is really bothering me, is that at this point, this is so bad for the economy. And people are like, well, like, people's lives are at risk. You can't care about the economy more than people's lives. I don't. And I don't think saying that a bad economy is because of COVID is a bad thing means I don't care about people's lives. Of course I care. I just do not believe for 1 second that me wearing my stupid piece of fabric on my face and walking around and not being able to go into businesses and shop there because I have to do it online, or having to go to a restaurant and not being able to eat there because I can't possibly sit inside this restaurant. I can go into it, pick up my food and leave, but sitting inside it is different. I can still go in and I can still get food. The only difference is I cannot sit there and eat it. You know, I've been saying this for the last couple months, honestly, that these things just don't make sense. But we're literally looking at a survival rate of 97. We'll even use the lowest number because it's still a huge number. 97% survival rate. So based on these numbers, if we're looking at the actual also asymptomatic cases, which, apparently people have COVID, yet they show zero symptoms, which I understand is a medical thing that happens. You can have, I think, like the flu or a cold or something. I think that's a pretty normal thing. But for whatever reason, we have a ton of cases of, I think an abnormally high amount of cases are asymptomatic. And I don't know if that's just because they're saying, oh, it's asymptomatic if someone tests positive, and in reality, it's just a false positive or something like that. Obviously, I mean, I don't know. There's not really a lot of data on that I could find. But if we're let's look at a 99.75% survival rate here. So you have less than 1% chance of dying from COVID, 0.25% chance of dying from COVID if we're looking at that number there. And the chance of dying from the flu is also less than 1%. I just think that if we're going to destroy small businesses, restaurants, and just, little stores, shops, family-owned things that can't keep up when they're forced to add all of these restrictions and not be able to serve people if there's, too many people in their store at once and things like that. If we're going to close all these businesses down, a lot of the time permanently, this is absolutely destroying small businesses. Shouldn't we at least have a really, really good reason? I would think so. I mean, I would expect a really high death rate. I don't know, even 10% would be crazy, but I think a 10% or even then it was just a 90% survival rate. And I say it would be crazy because it's still a crazy number of people that die, and it's still a terrible thing. I mean, it's horrible that anybody is going to die of this, but people die of the flu every year. And the number of cases aren't really that different. But we're shutting so many things down. We're destroying businesses, people's livelihoods over something that maybe is more political than reality. And, I've said this time and time again too, but we're going to wear masks and we're going to have restrictions put on us until somebody stands up for themselves and says, we're not doing that anymore. And now some businesses have tried to do that, and certain ones have been, fined or shut down. I mean, they've had things happen. I saw a couple didn't want to wear their masks somewhere and they got arrested for reckless endangerment. So there's definitely some bad stuff going on. But when the government is doing things that are completely unconstitutional, if we just sit there and let them do that, you lose your rights. You lose those constitutional rights because you don't care. You let them take them. When we were like the colonies and we came over from England, we weren't America yet. We didn't have those rights to begin with. And a lot of people fought very hard and a lot of people died and have since died to keep those rights. And I think it's pretty sad if we allow them to be taken over a sickness. I think so many people just don't see through what this is. Again, like if tons of people were actually like an abnormally large amount of people like have no comparison to like flu deaths because we consider that very normal. Again, still sad, terrible thing. But if it was an abnormally large number of people that were still dying because of this, and we could prevent their deaths by wearing masks, because again, I don't think that this prevents the spread. A lot of doctors agree that this does not prevent the spread. Even if they've changed their minds, you can find plenty of them on video saying that it does nothing early on from COVID stuff. And you can find so much research saying that COVID is so bad and all of these things. But why is it that we can't find any research on, what mask wearing all day long for months? I mean, this has been it's been more than 6 months. This has been nearly 9 months of just everything being closed down and not normal. And certain states don't even have these issues. I think like Montana or Wyoming and like some of those like, not Texas, but some of those like really conservative states, they like, you can go to the gym, you don't have to wear a mask. You go in any restaurant, you don't wear masks. I saw there was this town in Texas, no one has masks on. This person was videoing, they were just walking in the store. They were like, everything's normal here. Cause we're not like afraid for our lives because of getting sick. And we shouldn't be. You shouldn't be afraid to leave your house. And I think that's one of the kind of really big downsides too, is that there's so many people that are so depressed and so down because they've been locked in their houses for 9 months. That's not normal. And they haven't been able to see their friends, or, they're scared to. Liberals like to defend the doctors flip-flopping on the masks, as they were saying originally, healthcare professionals needed them more than you did. And I agree they did, because they actually were around sick people. I'm not sick. My parents aren't sick. My family isn't sick. So yeah, we're all going to get together for Thanksgiving and not be sick together, because you don't quarantine healthy people. You don't lock them in their houses. You don't force them to cover their face like they're diseased. My friend went into a store that she used to work in, and she still technically worked there at the time. She was just off for college, and she didn't have a face mask on. This was like really early on. And some guy, like just in the store, didn't work there or anything, just also shopping, he was like calling her like a diseased pig. He was like shouting at her like all these horrible things for not wearing a face mask. And like I said, this was really early on, so like not even all these stores had like signs on the door and stuff. And she got in the door fine, like it was a grocery store, so I mean, I'm sure employees saw her walk by and no one said anything to her. And this guy started yelling at her. And then an employee came over that she actually used to work with, pretended he didn't know her, and just like escorted her out of the store. And just like crazy stuff. I think it's so crazy that COVID has for some reason given us an excuse to act this way. It's given everybody an excuse to give terrible customer service and treat people terribly and act like you're above them so you can shame them for not wearing a face mask. Again, if this is something that's really effective and we're really saving lives by doing this, maybe something that we should talk about doing. But do we, even then, if that is the case even, which it isn't, do we force everyone to do it everywhere you go? Hospitals aren't filled. They never were filled, not in America. We have not had at all the number of cases that they predicted. And they like to tell you that they did. They're trying to push the numbers up however they can. They force college students to test like every week at some places. It's crazy. And now I was talking about this with my friends that, like, you know, you have to get a meningitis shot or something to go to college if you're going to be living on campus. But you don't actually have to get it. There's ways around it. And I think the COVID thing, if colleges start doing this, which I don't believe anybody has because the vaccine isn't really technically even out yet, but if people started doing that, I don't think there'd be any way around it. And that's what I think, like, I wish people would wake up and see that there's something really abnormal about this. And it isn't the number of deaths or the number of cases. It's the way we're handling it. The way we're handling something that is so similar to the flu that people get every single year. The case numbers, the flu, the really good news, the greatest thing probably to come out of COVID-19 is that pretty much no one has gotten the flu this year. Wonder why that is. Couldn't be because they're qualifying flu cases as COVID cases. I think that's something to think about. If you've enjoyed this episode, you can give me a thumbs up on YouTube. You can leave a review on Apple Podcasts, and you can also check out my Instagram at right.this.way.